Hello dear friends, I welcome all of you to this primer video. As you all are aware that intra-abdominal conditions are a major cause of critical illness. The abdominal CT is an important investigation to look for acute intra-abdominal conditions such as infections, bleeding, hemperitoneum or mechanical obstruction in the bowel. However, interpreting a CT scan is quite a tedious task if you have not learned it properly. It is a technique which requires both knowledge and practice. The objective of making this video is to make all of you familiarize with the normal anatomy of abdominal structures on a CT scan so that you can make out various pathologies easily before a CT report is available from an expert radiologist. There is strong evidence to suggest that only 5% of total teaching time in medical schools is dedicated to radiology, and that is the reason why medical students including postgraduate trainees show poor performance in recognition of life-threatening CT images due to probably the low confidence they have developed. How could we help them? How can we make them better? Perhaps creating such type of video would help you to enhance your knowledge of CT abdomen interpretation. So what are the main indications of abdominal CT in critical care or emergency areas? You should know when to order a CT abdomen. So CT imaging should be used once ultrasound is inconclusive. It is not able to make a proper diagnosis and there is a doubt on ultrasound, then obviously you have to perform a CT abdomen. That's important because CT abdomen is a costly investigation and also it requires shifting the patient to CT suite, and also lots of radiation exposure is involved. Henceforth, a few indications should be in your mind such as abdominal injuries and hemperitoneum, and to know the source of abdominal bleeding, and also to confirm abdominal or pelvic source of sepsis in cases of unexplained fever, and also in cases of abdominal distension which are not explained properly or intestinal obstructions which are suspected. CT scan also performed to grade the severity of acute necrotizing pancreatitis. In cases of abdominal collections leading to fever, it is quite imperative to do a CT scan and also to remove this under CT guidance. It is also performed to rule out the aortic aneurysms and aortic dissections. So there are two important CT planes through which we can look at the abdomen. Transversely, so this is your axial transverse plane, and the longitudinal plane. So these are two planes through which you can look at the abdomen. Further, in the longitudinal plane, there are two views, the coronal view and the sagittal view. Okay. For further information on this topic, keep in touch with me. I will soon upload this video. Till then, bye bye and take care.